Welcome to Marshfield Clinic. Annually, over 700,000 people undergo total joint replacement surgery. Primary candidates are individuals with chronic joint pain from arthritis that interferes with daily activities, walking, exercise, leisure, recreation, and work. The surgery aims to relieve pain, restore your independence, and return you to work and other daily activities. If surgery has been recommended to help relieve your pain, we want you to understand the procedure in more detail. Marshfield Clinic wants you to know what the alternatives are to joint replacement and what options you may have. There are non-surgical alternatives that should be tried prior to surgery. For example, weight loss, medications such as Tylenol and/or non-steroidal anti-inflammatory medications like ibuprofen and naproxen, activity modification or other non-operative measures such as physical therapy and injections into the knee. As with any surgery, knee replacement has risks and complications. We want you to understand these risks. They can include infection at the incision site, blood clots in the lungs, legs, or pelvis, ongoing knee pain, stiffness or instability, dislocation, loosening and implant wear, damage to nearby nerves, blood vessels, or tissues, healing difficulties, blood loss requiring transfusion, bone fracture, leg length difference, and infection of the bone around the implant that may require surgery to fix. Knee replacement surgery was first performed in 1968. Since then, improvements in surgical materials and techniques have greatly increased its effectiveness. More than 90% of people who have total knee replacement surgery experience a dramatic reduction of knee pain and a significant improvement in the ability to perform common activities of daily living. But total knee replacement will not allow you to do more than you could before you developed arthritis. Realistic activities following total knee replacement include unlimited walking, swimming, golf, driving, light hiking, biking, ballroom dancing, and other low-impact sports. For work restriction, we frequently recommend returning to work with job modification, such as no running, jumping, heavy lifting greater than 25 pounds, and no excessive bending. Most people can return to work with these restrictions. With appropriate activity modification, knee replacements can last for many years. Total knee replacement patients typically recover quickly. They'll typically be able to walk the first day after surgery. Generally, patients are able to return to driving in 6 weeks, dancing in 4 to 6 weeks, and golf in 6 to 12 weeks. Consulting with your surgeon and physical therapist for particular activities is the best way to determine an activity level suited to you. Your care team includes physicians, anesthesiologists, physician assistants, patient care technicians, medical assistants, nurses, discharge planners, pharmacists, and physical and occupational therapists specializing in total joint care. Every detail, from preoperative teaching to post-operative exercising, is considered and reviewed with you. The Joint Care Coordinator will plan your treatment program and guide you through it. You must register for a joint replacement class that's offered at your place of surgery, and you're encouraged to bring a family member or friend along as your coach. The information you'll obtain is invaluable. You must stop smoking before surgery. Smoking impairs your oxygen supply, which is important to your healing joint, and it increases the chance of infection and complications. Current smokers have an increased risk of wound complications following arthroplasty. Studies reveal that current smokers had approximately twice the rate of deep wound infection compared with former smokers or non-smokers. If you need assistance quitting, please talk with your primary care provider. The Wisconsin Quit Line is a great resource that's available 7 a.m. to 11 p.m. 7 days a week. The Quit Line is free and confidential. 1-800-QUIT-NOW. Obesity has a negative influence on the outcome after surgery. If you have a body mass index score of 40 or greater, you'll receive or be offered a clinical nutrition consult. Patients who are obese have more wound infections and a higher revision rate compared with patients at a normal weight. This rate becomes substantially higher at a BMI greater than 40 and can result in early failure of your total joint from poor wound healing or infection. Increased risks are associated in both the short term and long term. Other complications that are increased are stiffness requiring manipulation under anesthesia, systemic complications including blood clots, heart attack, respiratory failure, stroke, pneumonia, urinary tract infection, and blood transfusions. You should make every effort to increase activity and lose weight before surgery. Some surgeons may not do your surgery if your weight becomes too high, making surgery too difficult and high risk. Glucose management is extremely important in your healing. If you are diabetic with poor glycemic control, you have an increased risk of surgical site infections and revision rates. Good glycemic control before and after surgery is necessary to minimize complications and promote healing. Your hemoglobin, A1C, will be reviewed prior to surgery, and your medications will be reviewed and adjusted if necessary to lessen this risk. Tell your surgeon about all of the medications you take, including herbs, supplements, and over-the-counter medications. Some medications can cause bleeding, and your surgeon needs to know that ahead of time. Once a decision has been made by you and your surgeon for joint surgery, you'll be contacted by the joint coordinator. They'll act as a liaison between the doctor's office, the place of surgery, and the testing facilities. The surgeons will also monitor your outcomes, and this process will be further explained to you at that time. The Joint Care Coordinator will be responsible for your care needs from the preoperative course through discharge and postoperative discharge follow-up. He or she will explain the patient clinical team agreement that you and the surgeon will be asked to sign that reviews your partnership with your care team and your commitment to the recovery program. They will assist you with your needs as well as coordinate your discharge plan to outpatient services, home, or to a subacute facility. You should contact your insurance company to find out if pre-authorization, pre-certification, a second opinion, or referral form is required. If you don't have insurance, please notify the registration staff when they call you for pre-registration. Tell them you'll need help in making payment arrangements. After your surgery has been scheduled, you'll be asked to pre-register at the location of your surgery. Please have with you your Social Security number, insurance cards, emergency contacts, advance directives, driver's license or photo ID, and any co-payment required by the insurance company. You'll need to obtain medical clearance from your primary care physician or another specialist in addition to seeing your surgeon preoperatively. You'll need a few laboratory tests based on your individual health history prior to surgery. We'll be checking for any anemia present pre-op to allow for adequate time for treatment prior to surgery. All patients are screened with a nasal swab for methicillin-resistant Staphylococcus aureus, or MRSA. If this test comes back positive, decolonization treatment will begin prior to surgery to eliminate the bacteria. Before surgery, we'll review your medication and medical history with your anesthesia doctor. The anesthesiologist will discuss options for anesthesia. Regional anesthesia is used to reduce your risk of complications. Many patients with arthritis favor their joints and thus the joints become weaker, which interferes with their recovery. It's important that you begin an exercise program before surgery. Your physical therapist can provide you with some basic range of motion and strengthening exercises to guide you in your preparation for surgery. Medications that increase bleeding, such as anti-inflammatory medications and blood thinners, will need to be stopped prior to surgery. Your primary physician or joint coordinator will review your medications and give you specific instructions for stopping these medications. Have your house ready for your arrival back home. Clean, do the laundry, and put it away. Put clean linens on the bed. Prepare meals and freeze them in single-serving containers. Cut the grass, tend to the garden, and finish any other yard work. Pick up throw rugs and tack down loose carpeting. Remove electrical cords and other obstructions from walkways. Install nightlights in the bathrooms, bedrooms, and hallways. Pick up any assistive devices such as shower chair, grab bars, walker, raised toilet seat, etc. that will assist you in your recovery. Arrange to have someone collect your mail and take care of your pets or loved ones if necessary. Plan ahead now and you'll have less to worry about during recovery. Patients are able and will do better at home for recovery if they go home as soon as they are safe with ambulation by themselves. You should be as active as you can as soon as you can to prevent complications from inactivity like blood clots. Also, you'll sleep better at home in a quiet, familiar surrounding, which helps with maintaining strength for recovery. And finally, the risk for infection is lowest at home. Surgical site infection is a serious complication of surgery, and is usually associated with increased length of stay for the patient, and also higher hospital costs. You'll be asked to shower and use a special skin cleanser. This special cleanser will reduce the amount of germs on your skin. Specific instructions will be provided by your joint coordinator. Your joint coordinator will provide you a time that you need to arrive at the facility. You'll be asked to come in 2 hours before your scheduled surgery to give the nursing staff and anesthesiologist sufficient time to start IVs, prep, and answer questions. It's very important that you arrive on time to prevent your surgery case from being moved to a later time. The night before surgery, don't eat anything after midnight, including even chewing gum or a lozenge. You may have clear liquids for a few more hours. Specific instructions will be provided to you by your joint coordinator based on your time of surgery. Items you should bring with you are personal hygiene items such as your toothbrush, deodorant, a watch or wind-up clock, shorts, tops, well-fitting slippers, and flat shoes or tennis shoes. Don't bring any electrical items. If you use a nighttime breathing device at home, bring only the mask. And also bring a copy of your advance directives, insurance cards, photo ID, and walker. Please leave any jewelry, valuables, and large amounts of money at home. On the day of surgery, you'll be prepared in the outpatient surgery area. This includes starting an IV, meeting your anesthesiologist, meeting the surgical nurses, and seeing your surgeon as he or she marks your operative site. Following surgery, you'll be taken to the post-anesthesia care unit, where you'll remain for 1 to 2 hours. During this time, your pain control will be maintained, your vital signs will be monitored, and x-rays may be taken of your new joint. You'll be asked to rate your pain on a pain scale from 0 to 10, with 0 being no pain and 10 being severe pain. This will assist the care team in addressing and monitoring your pain management needs. You'll have sequential compression sleeves or venous foot pumps applied to your unaffected limb to help prevent blood clots from forming. You'll then be transferred to your room, where your care team will assist with your recovery. A physical therapist and occupational therapist will be seeing you to begin therapy. It's very important that you begin ankle pumps on this first day. This will help prevent blood clots from forming in your legs. Lung problems can happen after any surgery. To avoid pneumonia, you'll be shown how to breathe deeply and cough. You should do this at least a few times an hour. A respiratory therapist or nurse may teach you to use an incentive spirometer. This tool can help you breathe more deeply. The first day after surgery, expect to achieve independence in most of your daily activities, such as bathing, showering, getting dressed, walking with your walker, and getting in and out of a bed or a chair. If you had a drain inserted in your incision site or had a urinary catheter placed in surgery, these will most likely be removed on this day. Physical therapy and occupational therapy will occur to assist you in gaining independence. You'll have an additional therapy sessions before we send you home. Your individual instructions will be reviewed with you. When you're going directly home, you'll need somebody to drive you. If you're going to a subacute rehab facility, your joint coordinator can assist with this planning early in your discharge. Initially after surgery, it may be more difficult to perform the activities you need to do during the day. It's important for you to do as much as you can for yourself. Performing these everyday tasks yourself will not only speed your recovery, they'll minimize the stress placed on other members of your household. Whether you're recovering at home or in a rehabilitation facility, you need to protect your new knee. Practice your exercises. Avoid risky moves like twisting your knee or high-impact activities. And see your surgeon for scheduled post-op visits. These ensure that your knee is healing well. At home, your main goal is to control your discomfort. Remember to take your pain medicine at least 30 minutes before physical therapy. Gradually wean yourself from prescription pain medication to a non-prescription pain reliever. You may take up to 2 extra strength acetaminophen in place of your prescription medication up to 4 times per day. Change your position every 45 minutes throughout the day. Use ice for pain control, but don't use for more than 20 minutes each hour. Do not place the ice pack directly on your skin. For every 2 hours up in your chair or room, spend half an hour lying down in bed with the head of the bed flat and the surgical leg elevated on pillows. The knees should not be bent. Your appetite may be poor and take a bit to return. Drink plenty of fluids to keep from getting dehydrated. You may have difficulty sleeping, which is normal. Don't sleep or nap too much during the day. Your energy level will be decreased for at least the first month. Pain medications, surgery, and a decrease in your activity may cause constipation. You should, however, continue to take your pain medication, even if you might be constipated. Some suggestions to help prevent constipation include adding fiber to your diet, use of stool softeners or laxatives, increase your walking, increase the amount of liquid that you drink. You'll be on a blood thinning medication, prescription or non-prescription, for 3 to 4 weeks following your surgery. Your surgeon will determine the type of medication, and your joint coordinator will provide instructions to you on this medication and possible side effects to watch for. You'll receive specific discharge instructions regarding the dressing that was used for your surgery. It's normal for your incision to have some occasional drainage until it's healed. Notify your surgeon or care team if there is excessive drainage, redness, pain, odor, or heat around the incision. Take your temperature if you feel warm or sick. Call your surgeon if it exceeds 101 degrees Fahrenheit. Refrain from using a bathtub, hot tub, jacuzzi, or swimming pool for 6 to 8 weeks following surgery. Infection is a very serious complication following surgery. Bacteria can travel from anywhere in your body through your bloodstream and settle in the area of your new joint. Infection may cause problems including loosening of the joint and the need for revision of the joint replacement. Signs of infection include increased swelling and redness of the surgical area, change in color, amount and odor of drainage, increased pain in the area of your surgery with activity and rest, fever greater than 101 degrees Fahrenheit, bladder problems such as frequent need to urinate, pain or burning when urinating, sinus problems such as facial pain, pressure, congestion, yellowish-green nasal discharge, boils, burns or abscess on skin, dental pain, drainage or abscess. Take precautions to avoid infection. Call your healthcare provider if any signs of potential infections occur. Take proper care of your dressing. Take prophylactic antibiotics when having dental work or other potentially contaminating procedures. The orthopedic surgeons at the Marshfield Clinic advise you to be on lifetime prophylaxis for any invasive procedures. The joint coordinator will provide special instructions that will advise you what invasive procedures this applies to and how to obtain the antibiotic when needed. Notify your physician and dentist that you have a joint replacement. Please don't have any elective dental work for 3 months after your surgery. Surgery may cause the blood to slow and coagulate in the veins of your legs, creating a blood clot. This is why blood thinners are taken after surgery. If a clot occurs despite these measures, you may need to be admitted to the hospital to receive intravenous blood thinners. Signs of leg blood clots are swelling in the thigh, calf, or ankle that doesn't go down after elevation. Pain, heat, and tenderness in calf, back of knee, or groin area. Blood clots can form in either leg. Methods to prevent blood clots are ankle pumps, walking, blood thinners. Signs of pulmonary embolus or blood clots in lungs are sudden chest pain, difficult and or rapid breathing, shortness of breath, sweating, confusion. Methods to prevent pulmonary embolus include preventing or recognizing a blood clot in your leg. Call your physician promptly if this occurs. Physical therapy is a very important aspect of your ability to obtain the best results from your surgery. Your active involvement will aid you in achieving optimal functionality. Work closely with your therapist in order to achieve maximum results as quickly as possible. There will be routine follow-up visits with your orthopedic surgeon. It's important that your progress be monitored to avoid any avoidable complications. The orthopedic surgeon will also ask that you participate in a survey that will be provided at periodic intervals to monitor ongoing success with the joint. This type of survey is called a Patient Reportable Outcome Questionnaire. This information will assist your care team in monitoring the success of your joint program and make modifications when needed. Remember, joint replacement is a big surgery resulting in a change for your body, and it can take up to a full year to adapt and recover completely from any surgery. The more prepared you are for your surgery, the smoother your recovery is likely to be. Follow all instructions from your surgeon. Be sure you have support at home. Be sure to get answers to any questions you have before surgery. Through the Security Health Plan shared decision-making process, they communicate that 90% are happy with their surgery while 10% aren't. The 10% report it is better than before, but not wonderfully happy with the outcome. There are many questions that will arise during your journey through joint replacement. Don't hesitate to contact your joint coordinator at any time to ask questions.